Good evening, everyone. Welcome to Atp Live Monday. I am Gbemisola Boyede. I'm a pediatrician, and I'm here to answer any questions that you may have about the health of your children. And we'll be doing that in the next 1 hour. So if you have any questions, start to drop your questions. At the same time, I'm just going to go ahead and share the video, and I want you to do the same. Let's share the video so that people can see and they can hear us. And if you are here, you have a question, feel free to drop your questions, starting with the age of your child, and we'll try and answer them. Okay, just a minute. I just want to share. How has your day been? I hope you've been having a lovely day. It's quite pretty where I am, but cool all the same. All right, so welcome to Atp Live Monday. I'm Gbemisola Boyede. I'm your pediatrician for this evening. And what I'm doing right now is sharing the video to all the links, our groups, and making sure everybody can see me and they can hear me. So if you have any questions about the health of your children, we've got an hour where you can ask the question, and I'll do my best to answer them. Of course, if you have questions after the live session, not to worry, you can still always get answers to your questions. Just head over to Ask the Pediatrician's Facebook group, and you'll be able to ask your questions on our group from Monday to Saturday, 24 hours daily. Unfortunately, you'll be able to ask your question on a Sunday because our groups are not open on those days. But we'll always be back Mondays to Saturdays, and you can always ask your questions at that time. Just to let you know, if you have a question, please always start with the age of the child. As you're aware, pediatricians will see children from age 0 or even maybe earlier. We see children in the womb as well. But anyway, let's just say from age 0 to 18 years. So that's a huge a variety of people to see, and so the answers we give depends on the age of the child. So there are certain things that the answer will vary depending on the age of the child. So it is extremely important for you to tell us the age of the child, and then please go straight to the point. Just tell us in summary what is wrong and what's information you need. Don't tell us the entire life story of the child, because Facebook or StreamYard or whatever will cut off and I will not see the rest of it. So just try and tell us what is relevant, and don't also leave the information hanging. Tell us exactly what you want us to do about it, whether you want us to address, provide more information, or you want us to tell you what to do, whatever, but you have to tell us this is what you want us to do about your question. Because sometimes people just drop information and then they just leave it, and I'm like, okay, what am I supposed to do with it? So try and tell me exactly what you want me to do so that I won't have to guess, because I don't like guessing and I can't read your minds. Okay, so I think I've done all the sharing and pinning. I hope so. We can now start to answer questions. Instagram people, you're welcome. I can see you, but your questions tend to roll off after a while. So if you have question, please drop it now. I'll always come back and check intermittently. Okay, so now that I'm ready to start, let me welcome everybody once again. Good evening, ladies and gentlemen. Welcome to Ask the Pediatrician Live. I am Gbemisola Boyede. I'm a pediatrician, and my job this evening is to answer any questions that you may have about the health of your children. This program is brought to you by Ask the Paediatrician Foundation. We are committed to the health and well-being, welfare of all children globally, but more importantly in Nigeria and sub-Saharan Africa, where a lot of our children are still dying from preventable and treatable conditions. So what we do is to provide health information, health education. We also do community outreaches in schools, in indigent communities. All our mission is to make sure no child should die from preventable causes. So ATP Live Monday is just one of our programs where we get to ask, where you get to ask your question and we get to answer them live. But if you have more questions, we have groups, Facebook groups, where you can always post your questions and you can get answer. And what we promise is that the answer you get from our groups are evidence-based. Those are from a pediatrician's perspective. You can take them to the bank. It's different from what you get from other parental support group. It's not a democracy of opinion. It's about what is the best from a pediatrician's perspective. So that is what we do on Ask the Pediatricians Foundation. So welcome again to our ATP Live Monday, and I think I have a few questions already, so I'm just going to get straight to them and start to answer them. All right. So the first question I have is from Fola Shadi Akionla. It says 6-year-olds that have constant cough that resolve on its own within 3 days. What could be the cause? Okay, there are many possible causes of cough, recurrent cough, and you definitely need to see a doctor about that to know the specific cause in your child. So I'll be looking at things like bronchial asthma, because you said it tends to resolve on its own, which is typical of children who have bronchial asthma. But in addition to the cough, the children tend to breathe fast. They tend to have what we call wheezing sounds. So if your child fits into that category, you need to see a pediatrician. Also, children having cough on and off could be heart problem. Sometimes, yes, heart problem can also cause cough. So we need to know which one. So this is not something that we can diagnose just from the 3 lines that you have written. We need to see this child. We need to investigate the child. And most of those conditions are very pretty easy to diagnose. Most of us will diagnose asthma just listening to the chest, just getting the history from you. And a child who has asthma, and if it's recurrent, has to be on treatment daily to prevent it. And you also need to know what to do when they have attacks. Parents are the ones that manage asthma, so parents must know how to do it, because most of the attacks will happen at home, and you need to know what to do before you get to the hospital so that the child will not die from failure to respiratory failure and all that. So Folashade, you need to take your child to see a pediatrician for proper evaluation, diagnosis, and then they will tell you what next. All right. Okay, I will go to Instagram and come back again to Facebook. Somebody, the real Amaka, say good evening, Mama. Boy is 15 months old and he runs away from food. He takes yogurt, purees quite well, and that's it. Although we have to fight before getting him to take. What can I do, please? Okay, so we have children we will call picky eaters, fussy eaters. There are different kind of children, when it comes to food, and it is not unusual. It's a very pretty common thing. So we do have some tips for picky eaters. So I will recommend first that you go to our Facebook group. We actually have a guide section. The guide section, we have put together like group of posts and videos that address a particular issue. So there's one on complementary feeding. Number one, I want you to watch that first. Watch all the videos. First of all, understand complementary feeding, what you should be feeding your child, how often you should be feeding them, what quantity you should be feeding them, and the basics first. Then we also have a lot of feeding tips. Even on this our Instagram page, if you look through some of our posts on Instagram, we always have, or you can just search for it with the hashtag ATP feeding tips. So we have different feeding tips on how you can encourage your child to eat. Number one, we don't encourage you to force feed children. You should never force feed children to eat. We encourage you to give them what they like. It's okay. And then you gradually introduce new things. We want you to model to children. Don't let them see the times for eating as a torture time or as a world time or zone. Let children eat together with you on the table. Let them have colorful plates, colorful cutleries. Use their favorite cartoon character. That's what make it very interesting. Make sure the food itself is interesting. Make sure it's tasty. Make sure it's colorful. So these are little things that sometimes parents don't pay attention to, and that may affect children. And of course, for children that don't like to eat, we just keep offering food more frequently. Even if there's a little quantity they eat at a time, you just need to offer it more frequently. So we have a lot of tips like that which you can check out first and try. I just warn you that this is not a sprint, it's a marathon. Most time parents just want a quick fix, something that we can bottle for you, and then once you give it to the child will just start eating magically. There is none, and I don't recommend you going to buy so-called appetite boosters or whatever they call it. There are no drugs that are licensed to be given to children to make them eat or to boost their appetite. There are none. Most of the so-called appetite boosters, whatever that people sell, they are not meant to be used for that purpose. Those drugs have other reasons why we use them, and but one of the side effects could be the fact that people who use those drugs it can boost their appetite. It's a side effect, but the challenge is that there are other more terrible side effects for those drugs. So you don't want to go and be giving your children unnecessary drugs just to make them eat and for them to develop other difficulties in the process. So make sure you don't go that way. It is the solution to a child who is not eating is still to give the child food, nothing else. But you just need to now use different approach, different strategies, and persistence and patience, and then you will get there. So I hope that is helpful for Amaka. All right, the next question still on Instagram. Favy Crunchy Sports. I went to see a pediatrician and she said my son's breathing is high, that the normal breathing is 15, but your son is 60. Always start with the age of the child. Always just start with the age of the child. It's so important. Now you are giving me figures about your child's respiratory rates. You have not told me how old your child is. I can't even make a sense of how that. So that's why it's important again to always start with the age of the child. Anyway, you've seen your pediatrician has told you what to do, so just do what your pediatrician asks you to do. All right. Okay, your child is 7 months old. So yeah, a 7 months old who is breathing at 60 is breathing fast. So that is what we call tachypnea. And did your doctor tell you why your child is breathing fast? I can't seem to get that. Because if your child is breathing fast, the next question is why? Okay, and I don't seem to get that information in your write up, and I wonder why your child was also not admitted. If a child is breathing fast, most pediatricians will admit the child, we will investigate the child, and then we will treat it. So is it pneumonia? Is it bronchiolitis? There are many reasons why children could breathe fast. It's a heart problem. All right, something blocking the nose will not make the child to breathe fast. So that I don't agree with, unless there are other issues. If the nose is blocked, the child will have what we call noisy breathing. They'll be loud, when the child is breathing to be noisy, but it won't be fast. So when something is fast, it has to come from the lungs, it has to come from the chest. So you can always go back to your pediatrician if your child is not better. It is not for you to be saying, what do I do after you have seen a pediatrician? That is the reason why you want to see a pediatrician. So the pediatrician should be telling you what to do. And if you're not comfortable, you're not satisfied, then you have to see another pediatrician for an alternative. But that child has to be seen properly. All right, official Dwara, say good evening. My mom is swollen. What do you mean your mom is swollen? I don't understand that question. By the way, I am a pediatrician and I always try to abide by my calling. So I will answer questions. Oh, your gum. Oh, your gum. Yeah. So, yes, sorry about that. Okay, I think I didn't say it properly. All right. So, but if your gum is swollen, you have to see the dentist, not unless there are other health issues that you have that can explain your gum being swollen. All right, so official Dora, just see the. All right, okay. Ria Maka said thank you. We read through the articles. That's lovely. All right, official Dora now say good evening. My 20 months old baby gum. Oh, okay. So it's your baby, not you. All right, okay. Your 20 months old baby gum is swollen, no pain or fever. So, is your child bringing out teeth yet? That's the first question. And if the child is bringing out teeth, how many does the child have now? Any bleeding when you're brushing the teeth and all that. So, we need those kind of information because sometimes the gum is swollen when the children want to, a new tooth is about to erupt out of that gum. But if that is not the case, then you and sometimes it could be if there's inflammation, then when you brush it, it'll be bleeding and all that. Either way, the dentist is your person. That's the person you need to see for anything that has to do with gums or teeth. Since the child is not otherwise ill, you said there's no fever, no pain, the child is otherwise well. So why are the gums swollen? Sometimes we also get it in children who have some vitamin deficiency and all that, but the dentist also be able to work that whether it's just a dental problem or it's something more generalized. So, but I think it's best to see the dentist first and then they can take it up from there. All right, let's go back to Facebook. Okay. Um, let's go up. All right. So Sharon, Princess Sharon, can bilirubin of 18.5 affect the brain of an 11-day-old baby? Um, there is no. It's a little bit tricky question to answer, but I will tell you why. Number one, you've not only okay, your baby is 37 weeks, so it's a term baby, and your baby is 3.3, so it's a term baby. That's good. So 18.5 is high, but we usually talk about brain damage from the level of 20. So usually 20 is common cutoff. But then if a child also has all the issues, like the child is also ill and all that, that may make it worse even at 18.5. But for example, your baby is preterm, but luckily your baby is not preterm. So when if there's no other health issues, then 18.5 is pretty high. We are definitely going to be making sure we're getting the child. And 18.5 at 11 days old, the question is, was it higher before? Was that the first level? Because 11-day-old is actually a pretty old baby. So usually by that age, we expect the jaundice to be coming down. So if it is still as high as 18 at 11 days old, the question is, was it higher before? So it's a little bit tricky. So theoretically speaking, we will worry when the level is 20 and above, but that depends on whether this child's jaundice has been picked up early, they've been checking it, and they've been treating it and all that. But if the first time your baby's jaundice is going to be detected is at 11 days old and it's 18, that is pretty high. And we need to be sure it's not higher than that before. But the most important needs to treat the child. The effect of whether the baby's brain has been affected or not is going to be in future. We're going to know. We won't know now unless the child is already showing us signs like having seizures, stop sucking, But most children may not show all those signs at this point. But we monitor the child when they are older. 3 months, we want to see neck on trip. If there are other issues, then we can always trace it back to maybe the jaundice causing the issue. But it's a little bit tricky at this point. All right, Folashade Akionla is saying 6 years old male and make teeth is yet to follow. Of any concern? No concern. Usually it's 5 to 7 years when children start to change their teeth. So I won't worry about that. But you should be seeing your dentist anyway. The dentist wants to see all the children from the age of 1 year, and they want to be seeing you every 6 months so that you can have this opportunity to have this conversation with the dentist. So you may want to just check up on your dentist and make sure they are happy with the teeth. But they have a way of knowing whether the permanent teeth are, they are there in the jaw, even though you've not seen them up. The dentist can always figure that out. There's nothing to worry about anyway. All right. Oh, Sharon, you keep asking this your question about jaundice. This is like the third time I'm answering your question about it. I don't think I'm going to answer it anymore. I think we have answered that question enough. If you have any issue, just take it up with the people that manage your child's jaundice. And I don't really think it matters now. The most important thing is, how's your baby now, and is your baby okay? So just let it rest. Stop worrying yourself about all these jaundice up and down. I'm sorry that you have gone through a lot of stress of results. Results are as good as the people who are doing them. It's as good as the lab where they are being done. So we are not strangers to the fact that different labs can give us different results. And that is where the pediatrician comes in, because there's a way a child will look to us clinically. So sometimes you see a child and you get a result, you just know that this is not compatible. So there's a way we check for the jaundice on the child's body. So if a jaundice is only on the face, I'm expecting it to be between 5 and 7. If it's on the chest, maybe it's about 11 to 12. By the time it's getting to the hands and feet, then we already know it's about 18 to 20. So there's a way we can figure out. So if I see a child who doesn't look jaundice, or who doesn't maybe just have a bare inch of jaundice only on the face, and I'm getting a result of 18 to 20, I'm going to doubt that result. Then I'm going to ask for it to be done again, and compare, So that is how pediatricians work. So we don't just rely on the lab. We don't treat the test. We don't treat the test result. We treat the child right in front of us. So you must have an idea yourself as a pediatrician before you do your test. So when your tests come out, if it looks compatible with what you think clinically, yes, fine. If it doesn't, then you have to check again, and that's what we do. So yeah, lab can give us false. There are many reasons why the lab give false information and all that, but I don't think it really matters anymore. The reason why I know that you've asked this question maybe about 2 weeks ago, so your baby is definitely is no longer 11 days old. So we've already gone beyond that. So just let it rest, okay? I know that because I've answered that question several times, so I recognize it straight away. All right, let's move on to Viva Claus Chinanye. Is bilirubin of 4 okay for a 26 years old baby? Bilirubin of 4 is not even jaundice. So we start talking about jaundice from 5 and above. And I'm like, why are you doing jaundice level for a 26-year-old baby? Again, at this age, we are not worried anymore about jaundice. So that is not jaundice, and that is not something we're going to worry about. All right, let me answer one more question before I go to Instagram. Abigail Hadetsula, can a 4-year-old tantrum attitudes and bullying be classified as autism? No. Bullying, tantrums is not that doesn't mean the child has autism. Of course, a child who has autism can also have a child who has autism can also have tantrums, can be bullying, but this is not how we make a diagnosis of autism. So you don't make a diagnosis of autism purely on behavior of a child. I hope that's helpful. All right. Let me just quickly answer a question on Instagram because they tend to disappear. So baby crunch spots, exactly. So if if you've done a chest X-ray and your chest X-ray is showing bronchopneumonia, so that child that's what I was trying to explain to you, that your child breathing fast is not from blocked nose, it's from the pneumonia. It's the child has bronchopneumonia. So I'm happy your pediatrician has asked you to do a chest X-ray. You need to take that child right now back to the pediatrician so they can treat the pneumonia that the child has, because that is why the child is breathing fast. Okay, and personally, if I see a child breathing fast and I'm suspecting pneumonia, I'm not sending you home. I'm keeping you in the hospital and I'm starting the child on treatment, and I'm only sending you home when the fast breathing has come down a bit to normal. So, but different people do different things, but that's what I would do. But I can't say why your doctor is doing differently. So um that's my own. All right. So yeah, just have your conversation with your pediatrician. That's the next thing to do. So Abigail, if you suspect that your child or a child, I don't know whether this is your child or just rhetorical question. If you think your child has autism, you need to see a developmental pediatrician so that they can do a proper autism assessment. There are specific things we're looking out for to make a diagnosis of autism. So we're looking at two big criteria. We call it criteria A and B. A, we're looking at that child's social interaction and social reciprocity. So is this child doing things together with other people? When you smile at them, do they smile back at you? Do they have friends? Do they play with other children? Do they respond when you call their name? Do they give eye contact? Those are the things we're looking out for in A. So the child who has autism will not give eye contact, they don't respond to their name, they don't use gestures, they may not interact with other people, they don't know how to do back and forth, they can't have a conversation back and forth, they don't have friends, they want to play on their own, isolated in their home bubbles. That is A path. It doesn't mean the child has to have everything I've said, but those are the gist of what we expect to see in a child who we are suspecting has autism. Then the B part, they must have what we call repetitive behavior, repetitive restricted pattern of behavior. So they may be flapping their hands, they may be spinning around in circle, walking on their tiptoes, they may be obsessed with certain things, they only want to eat from a particular place, they will only sit on a particular spot, they only want to eat chicken nugget from McDonald's, they will never eat from any other brand, those kind of things. Or they, when it is time to leave, they don't want to leave, they want to do things in their own way, or they know so much about one thing alone and they want to watch that particular program, they watch it over and over 1,000 times a day. So those repetitive kind of behavior, those obsession, those rituals, those are the big parts. So for a child to have autism diagnosis, the child must meet criteria. And they may also have sensory issues, they don't like loud noises, they don't or they don't like to touch maybe play-doh or certain things, or they don't want to eat a particular food, they only want to eat dry food, no wet food, they don't want food touching each other in their plates, all those kind of issues. So a child who has autism must be meeting criteria in A and in B. So tantrums or what's it called, bullying does not necessarily mean a child has autism, because you can see that tantrums and bullying are not part of those criteria I've mentioned. But that does not mean a child who has autism cannot have tantrum just like any other child, or cannot be bullied, or can bully other people just like any other child. But those are not the critical or fundamental criteria for the diagnosis of autism. I hope that is helpful. All right. Let me move on to the next question. Viva calls. Okay, Chinaye. Okay, what was your first question? Okay, it was 14.3. So if it was 14.3, that was high. That was jaundice. So if it's now down to 4, that means the jaundice has resolved. That's what it means. But really, we're not worried about in 26 days old baby. Nobody is supposed to be doing jaundice tests. We are worried about jaundice usually in the first 2 weeks of life, because after 2 weeks, your baby should not be having jaundice. If your baby is still having jaundice after 2 weeks, it is prolonged jaundice. That's what we call it. And prolonged jaundice is another ball game altogether. Then we have to look for what are the causes of persistent prolonged jaundice. So then we now have to start thinking of those ones separate things to think about altogether. But most babies will have their jaundice in the first 1 week. By 2 weeks max, all the jaundice have gone. So that is why we don't typically do jaundice tests in a 26-year-old baby. We don't expect to see jaundice. We will only do a jaundice test at that age if we can see physical evidence that this child still has jaundice. So, and obviously from that figure, a jaundice level of 4 is not going to show on anywhere. It's not going to show on the face. It's not going to show anywhere. So that means there was no physical evidence of jaundice at that time. So there's no reason to have done that blood test in the first place. So that's what I'm just trying to say. So baby crunchy spots, you just need to go see your pediatrician, have a conversation with them about your baby's breathing fast. If your baby is breathing fast, your baby has pneumonia and is still breathing fast, you need to see the pediatrician. Like I told you, they may want to keep that baby in the hospital. There are some conditions we don't treat on outpatient. There are some conditions we keep the child in the hospital and treat. And if we are not satisfied, we may even ask to get other specialists to see the child. So we may want to say, you want to also check the heart. There's no murmur, there's no heart problem, because the two of them can coexist. So I really want you to make sure you are getting the right. So if you want a second opinion, you may want to go to a government hospital. Go to a government hospital, general hospital, teaching hospital that has a pediatrician, then they can manage your child properly. If you are not comfortable, because I have a feeling that you've seen a doctor, you done all these tests, but you're still asking a lot of questions. So that means maybe you're not really comfortable with the management of your baby so far, which is okay. Then what you need is a second opinion kind of management. And at this point, I recommend you see a pediatrician, maybe at a tertiary level. All right. Ibukunluwa Farayola, my 20-month-old is not verbally communicating yet. Does she understand instruction well? Understand things well? Once in a while, she repeats words, but not always. Okay, so if your child is just not talking, and a 20-month-old should be saying at least a lot of single words and trying to combine them to form two-word phrases. So if it's just only the language, you can see a speech therapist. They are the ones that will sort that out. But if there are more to it than just the speech, then you have to say developmental pediatrician. In other words, if there are other area of that child's development that is also behind, that is slow, then you have to see a pediatrician, a developmental pediatrician for further assessment. All right, let's move on. Eva, Miss Samuel Major. Good evening. I have Kata and I don't want my 3 months old to get it. Should I start giving him vitamin C? No. No, you don't need to give him vitamin C. Just breastfeed the baby. Cover your own nose when you are coughing and having catarrh. Wear face masks to limit your. Obviously, you have to breastfeed your baby, so we can't say you should separate yourself from the baby. So, but wear face masks. Try not to sneeze or cough, into the baby. Make sure you're washing your hands, just like what we're doing during the COVID era. That's what you need to do to protect your baby. Taiwo Tolani Matthew, what's the cause of this jaundice? Okay, I'm scared to be pregnant again. You don't need to be scared. 60% of babies are going to have jaundice. 60% of term babies are going to have jaundice. And 80% of preterm babies are going to have jaundice. So it's a very common thing in children to have jaundice. Most jaundice in children are what we call physiological jaundice. They are basically normal jaundice. We don't need to treat it. They are not so high. The child have jaundice 3-4 days. By 5-7 days, the jaundice has gone to the peak, and it won't be up to 12. The maximum it can be is 12, and then it's coming down by end of week 1. It is completely gone. That is what we call physiological jaundice. There's no cause. It's just what is happening there is that babies have a lot of blood, because when babies are in their mother's womb, I've done a lot of teaching on jaundice. I recommend you listen to the podcast on jaundice, because I can stay another 1 whole hour just talking about jaundice. But basically, let me plug my. Okay, so basically, the babies that when the babies are born, they have a lot of blood in their body, more than they need, because when the babies were in the womb, they are trying to um steal a lot of things from their mother, so they need a lot of blood to steal those things. That's the way to explain it to you. So babies generally, when they are born, they look so red because they have so much red blood cells, because they don't breathe for themselves, so everything they try to steal away from their mothers, so they need a lot of blood to do that. But when babies are born, now they can breathe by themselves, they can get their own oxygen, so they don't need as much of those red blood cells anymore. And then those red blood cells, they don't last for long. So for you as an adult, your red blood cells will last for 120 days, but for newborn babies, they last for maybe about 30 days or so. So the babies have to break down all those extra red blood cells. They have to break it down, and it is the breakdown of those red blood cells, the body has to clear it out. And But babies also, the organs that normally clear it out is the liver, which is not fully matured in newborn babies. So that breakdown of those red blood cells is what forms that bilirubin. It is that bilirubin that you see in your baby's skin, in their eyes as jaundice. So the liver will eventually clear them off, but it may lag behind a little bit. So that is why babies tend to have jaundice. It's just the liver, the body breaking down the excess red blood cells and the liver trying to clear it out, but it's not as efficient as that of an adult. So that is what happens in physiological jaundice. But however, there are certain situations that can make the situation worse. So, for example, if the mother's blood and that of the baby didn't match, mother is O and the baby is A or B, then the mother is producing antibodies that are also breaking down more red blood cells. So when we have what we call GCPD deficiency and the child is exposed to those substances that can cause the red blood cell to break down more. So those are the situations where you now have what we call pathological jaundice. So the jaundice will be higher than what you will get for most babies that they don't even need treatment. So those are the ones that tend to have high level of jaundice, and those are the ones we need to treat. Or there may be a problem with the liver is not able to clear it out, or there's a block in the liver, there's what we call biliary atresia. So there are many causes of jaundice depending on the type of jaundice. So if you want to really know more about jaundice, go to our website, read our articles on jaundice, or listen to my podcast on jaundice on Ask Dr. Gbemisola ATP podcast, so you will understand. So saying because you are scared of jaundice, you won't want to have a baby, that's not necessary, because babies can have jaundice normally, and then they can have jaundice in certain situations. The most important thing for us is to pick up the jaundice early. So we should pick up jaundice early and we should treat it. So all you people that have babies, don't be rushing to go home, especially if you live in a country where you don't have health visitors. So countries that have health visitors like the UK, somebody comes to the house to check the baby, they check the baby for jaundice, they can test for those jaundice, and then they can refer the baby back to the hospital if needed. But if you are living in a country like Nigeria where we don't have that facility, then don't be in a hurry to go to home. Usually stay in the hospital for 2 to 3 days, so that most people that are going to have jaundice, they will have it in that first 2 3 days, and so we can start treating it. And the only way we will know whether we need to treat the jaundice or whether we don't need to treat it is depending on the level of the jaundice. So we need to do a blood test. So this morning I was here answering a question in our group, people saying, "Oh, my baby was fine to have jaundice on the day one of life, and I was due to put the baby to the early morning sun." That is absolute nonsense. Number one, any baby that has jaundice on the first day of life is already pathological jaundice. You shouldn't be having jaundice on the very first day of life. Jaundice usually starts by the second, third day. So if a baby is already having jaundice on the first day, baby is born, it is most likely a pathological jaundice. In other words, it's going to be very high. So we need to treat. So they need to take blood. So don't just say, people tell you my baby had jaundice, go and put it under lights. No, that's not how jaundice is managed. Or go and give ampiclos, or go and give purple water. No, that is not how jaundice is managed. Okay, anytime your baby has jaundice, they must take blood. They must know the level of the jaundice, because it's the level of the jaundice that will determine the treatment. So there are some jaundice that we don't treat. We just say you keep breastfeeding your baby and go home, and then come back again. So we will check it in 48 hours to see whether the level is going up or is going down. If it is going down, we are fine. We may check it one more time, or we may not bother, depending on how low it is. But there are some level of jaundice that we have to put your baby under light, phototherapy, and there's a level of jaundice that we have to take away the blood. We have to exchange the blood and put in fresh blood into the baby. So what we call exchange blood transfusion. So jaundice is managed depending on the level. And why are we so paranoid about jaundice? Why is jaundice an important issue? Like I was telling the person when I was asking the question this morning, the jaundice is not our problem. Whether we treat the jaundice or not, jaundice is going to go away. Jaundice, no matter what happens, eventually the liver will get hold of those jaundice and it will clear it off from the body. So the jaundice, the high looking yellow, which is what mothers seem to be worried about, that is the least of our worry, because we know that will eventually clear on its own anyway. But the issue is that when jaundice is high, it can get to the brain of the baby. And when it gets to the brain of the baby, it can cause a brain damage. Okay, so, and that is the main challenge, because once the baby's brain is damaged, baby is going to have complications, cerebral palsy. Baby can even die from that. So that is what we don't want to happen. And that tends to happen when the level of jaundice is so high, like it's up to like 20 or and above. So we don't want that to happen at all. So that is why we need to know the level of the jaundice. So that's why we need to know whether when we're treating, we need to be checking, is it going up, is it coming down? And we need to be sure it's clear. And then we need to know the cause of the jaundice. So there are some causes, right? I mean, if your jaundice is due to sepsis, we still need to give the child antibiotics. If it's due to certain condition, like if you have a rhesus negative blood group and your baby is rhesus positive, we need to give you Rogam in all your pregnancies once you have a rhesus positive baby. So there are so many things we need to know. So it's not enough to know that the baby has jaundice. We need to know how high the level of the jaundice is, and we need to know the cause of that jaundice. Those are very important things, and that is what will determine how we treat the jaundice. So it's not a blanket go and put in the early morning sun, or go and give purple water, or go and give ampiclox. No. Unfortunately, many people don't take jaundice seriously because they want to go home, they want to do naming ceremony and all that. And then the baby come back to us and the baby has already suffered brain damage. There's nothing we can do. Once the brain is gone, the brain is gone. We're just going to live with the consequence, but we can avoid that. So jaundice is a preventable cause of brain damage. So once we're able to treat it properly. So it's not the jaundice itself, it is about making sure we pick it up on time and treat it on time. If you treat the jaundice properly, there'll be no brain damage and there's no reason to be worried. So Lani, I hope that has reassured you. So feel free to have your babies. All right, Eugenia is my baby is a year 5 month old. Weight All right. Apologies for that. Um, my my phone, my laptop went off. So I hope people can still hear me. If you can hear me, say me. Let me know you are there. But I'm not sure whether Instagram people are still there. Let me just log in on my phone for Instagram. Um. Okay. Sorry. Okay. Apologies for the break in transmission. So let me know whether you can. Okay, I'm not sure whether my Instagram is still live now. Okay. Okay, so I think I'll just go live on Instagram on my phone and then I can. Yeah, okay, so some people are still live with me. Okay, thank you so much for being patient. My phone went dead, my laptop rather. So I just have to come back again. All right, so let me just. Uh, okay, all right, let me see. Okay, yeah. Okay, I think they're having issue getting back on Instagram. Okay, fine. Instagram people, we have to start afresh. So just bear with us and just join me on my phone. All right. Okay. So let's continue for this on Facebook. Uh, where is the current comment? Mm-hmm. Okay. All right. So Eugenia said, my baby is a year and 5 months old. Birth weight was 3.0 and now weight is 9.7. Is she underweight? No, technically not. Average 1 year old weight 10 kilos. So 9.7 is still very close to 10 kilos. So I won't be worried about that. So but you need to work hard on it, make sure the child is eating well, and then and make sure you're doing appropriate feeding of the child and all that. But technically, your baby is not underweight, but we need to monitor that. All right, Instagram, if you have question, ask. Unfortunately, you won't be able to see my uh, other questions from Facebook, but I'll be reading it out so you can just listen. All right. Oladoyin Ogunmuyiwa Hajani, a baby born at 36 weeks, is it preterm? Yes. So let's just solve this issue of preterm. The key age is 37. Once the baby is born before 37 weeks, even baby is born at 36 weeks and 6 days, it's still preterm baby. So your baby is only term from 37 weeks. So I get this question a lot of time. People are just kind of worried about because maybe it's 36 weeks, it's still preterm. As long as it's not 37, it's preterm. Even if it's just 1 day to 37 weeks, it's still preterm. So it has to be 37 completed weeks for you to be a term baby. All right. But we will call your baby a late preterm, but it's still a preterm. And how will you calculate the age of baby? The same way we calculate the age of every preterm baby. So preterm babies always have two ages. We have what we call their chronological age. So the chronological age is the same way you calculate age for everybody. If you are born on the 1st of January, every 1st of January will be your one, let's say 1st of January 2023, the 1st of January 2024 will be your 1 year birthday. It's the same for everybody, whether you are preterm or not. But for preterm babies, we correct their age. So they have another age we call the corrected age. So that corrected age is calculated based on how early they were born. So for a baby that was born at 36 weeks, normal date is 40 weeks. So that means your baby is born 4 weeks earlier. So we'll be subtracting 4 weeks from every chronological age of the baby. So that is that for preterm baby. And then can it cause baby not to suck breast immediately? Not necessarily. So there are many reasons why baby may not be able to suck. So it's not just about the preterm or prematurity. Was your baby sick? Was baby struggled to breathe when baby was born and all that? So there are many issues. I believe you should be having that conversation with your pediatrician. So if your pediatrician should be able to tell you exactly the reason why your baby did not suck until 4 weeks, that sounds very unusual, and it has something to do with prematurity. Even for babies that were born 1.8, born 32, 28 weeks, they're sucking. So it's not a prematurity thing, it's something else. But you can ask your pediatrician and they'll be able to tell you. All right. So I've got one question on Instagram. Uh Valley Bank. So is there a possibility to avoid this jaundice while pregnant? Okay, that's a very lovely question, because obviously we've almost done today's episode with jaundice episode. Oh my goodness, it's almost time. All right. So some jaundice can be prevented, but some cannot. So, for example, if you are rhesus negative, you are a rhesus negative mother, your blood group is a negative blood group. Anytime you are pregnant and you have a baby who is rhesus positive, we will give you Rogam. So that Rogam will prevent your baby, your next baby, from having jaundice. So that is one jaundice that we can prevent. But if you are O positive, O blood group, for example, and you are married to somebody who is A or B or whatever, and which means that some of your children will be A or B, and you are always going to be whole, those your babies will always have jaundice. We may not be able to prevent those ones. So if some babies have GCPD, some jaundice we can prevent. So some, like rhesus incompatibility, we can prevent. So I think the most important thing for us when it comes to jaundice is not preventing it. You can't always prevent, you don't always have control over jaundice, but the most important thing for us is to be able to pick it up early and treat it properly, and that is what we need to do. All right, so I hope that's helpful for Bill. I'm not sure I'm pronouncing the name well. All right, the next question from Facebook now. Oldebumi Gold Ibuoye. How do I boost my son's weight? Okay, weight is 2.9, current weight is 7 kilos. What's the age of the child? Always starts every question with the age of the child. Should I get on my knees? Okay, you can't tell me how to put the age of your child, the weight of your child, when you have not even told me the age of your child, because how do I know whether the 7 kilos is okay or not? I can't. You have to tell us the age of the child first. So unfortunately, we can't help here. The wise Abdul Kadri. My baby is 18 months old and still weighs 8 kilos. So what do I do? So an 18 months old weighing like 11 kilos. So your baby is about underweight. So the question is, why is this child eating? We normally start with food, because food is the most common reason why the child could be underweight. So are you giving the appropriate food? Are you giving protein and giving variety of food? Are you doing the appropriate complementary feeding? This child still breastfeeding, so you need to make sure you are giving adequate quantity in the right frequency. So the whys, that is where we will start from. If you are sure your child is eating well, you are giving variety of food, you are giving enough quantity, the child is eating well, you have dewormed the child from the age of 1 year every 6 months, and your child is still not gaining weight well, or the child is on the weight, then you have to see us. You have to see a pediatrician, so we can delve deeper to know, is there any reason why the child is not gaining weight? Is there underlying health issues? And then we can deal with that. So that's what I'm going to advise that you do. All right, Chisholm Florence is asking, what is different between miliary rash and septic rash? Yeah, there's a difference. So miliary is a It's a rash that baby has, usually in the first week of life. It looks like white spots, like white dots. It looks like white dots, usually common in newborn babies. And that is it. Whereas septic spots, which is what I think you're trying to ask, is pus, pus, the pus that you have when you have boil. So that is the one that is you see in septic spot. Usually it's yellow or milky, it's yellow, or it's pus, and it tends to be bigger, and and of course, child may have fever and all those stuff, or may not have fever too, but it tends to be, its pus is yellowish or milky, and it is usually bigger than milia. So milia, we don't do anything about milia because it's going to clear. You don't need to do anything about it. However, for um, septic spot is a sign of bacterial infection, so you have to make sure that you boost the hygiene around the baby and watching. Usually, most of the time, septic spot is from the hands of people touching the children. If they are not washing their hands and all that, so that is where most of the septic spots is coming from. So make sure people wash their hands before they touch the baby. Make sure you're paying attention to hygiene around the baby and all that. So if you're doing all that, some septic spots will just clear on their own. But if it's getting more, or just having fever, then you have to see us, because we have to put the child on antibiotics. So that is about septic spots. All right, I got a couple of questions on Instagram, so let me just answer them before I continue. Okay, so Violet Tack Banks, you say your two children have it. What is your blood group? Oh, you need to tell us your blood group. So if your babies are always having jaundice, you most likely have a recurrent reason for that jaundice. So you need to know your blood group first. That may help you. And it's important that your doctors investigate to know the cause of your baby's jaundice, so to know why they are having it. Yeah, and it can happen, and sometimes it can happen with physiological jaundice, and there's no cause really. So, but it's important to know. Toby is saying my baby is 6 months, weight is 5.5, birth weight is 1.9. Was the baby born preterm? Okay, baby was born preterm. You need to tell me how preterm the baby he was for me to calculate whether the weight is okay. Because, like I answered the last question, we have to correct the age of the baby. So even though your baby is 6 months old, that is the chronological age of your baby. We need to know what is the corrected age of the baby. It is that corrected age that I will now use to know whether the weight of 5.5 is okay or not. So if you are still listening to me, to be, just tell me the how many weeks your baby was born, and I can tell you whether the weight is okay or not. Judy Musonda, she's 5 years old, have forehead pain. She has sinus for some time. What could be the problem? You've already told her what the problem is, so I don't know what is your question. You say your child has forehead pain. I guess you mean headache or what? And she's has sinusitis. So yeah, so what that is the problem? I don't know what you are trying to ask. Maybe you need to clarify. Maybe I'm not getting your question properly, on, or unless you've said something earlier that I missed out when I kind of lost my connection and I just came back. So just let me know, Judy Musonda. All right. So somebody's asking, Violet is asking, at what age is appropriate to lay the baby on the tummy? Oh, you mean tummy time? Usually people do tummy time. Even from that first 1 month of life, you can do tummy time. The most important thing is that do it when your baby is awake. Do it only for about 5 minutes and remove the baby on the tummy. It's not something that's supposed to be on it forever. So I hope that's helpful. Oh, okay. Dr. Rena, welcome. Thank you for joining. All right. Okay, Toby say your baby is IUGR. She was 32 weeks. I was 38 weeks. I don't understand. Who is 32 weeks? Who is 38 weeks? Um you can't be 32. So what I need to know, was your pregnancy 32 weeks or 38 weeks? Because they are two different things. So if she was born at 32 weeks, it is not what the doctor says she looks like, whether she looked like a 32-weeker. Was she born at 38 weeks, even though she was 1.9 kilos? In other words, she was born at term. That is what matters. It's not whether she looks 32 weeks. So the pregnancy itself is what determines your baby is preterm or whether it is term baby. So your baby was born at 38 weeks. Your baby is term baby. Your baby is not preterm. Your baby is low birth weight but not preterm. There are two different things. So your baby can be low birth weight and term, and your baby then, which can be why the IUGR. But your baby can also be um preterm and also low birth weight. So we need to know the difference so that we don't give it the wrong answer. Okay, Felicia Agbo was, thank you for your help. How can I help my baby? She's having catarrh and cough. I took her to the hospital. They gave her Orofa, and yeah, blood levels. She's still okay. The rest of your question has been cut off. Okay. Toby, your baby was stopped growing was your baby born at 38 weeks? If your baby was born at 38 weeks, your baby is not preterm. Your baby is term. So your baby is term baby. We don't need to correct the weight. We don't need to correct the age, rather. So if your baby was born at 38 weeks, we don't need to correct the age. So your baby is not preterm. Your baby is term. Your baby is just a low birth weight baby. And if your baby is low birth weight, at 6 months, your baby should be weighing more than 5.5 kilos. Your baby should be weighing closer to 7.5. I know your baby started small, but we expect the baby to catch up. So I hope you are seeing a pediatrician so that they can, how are you feeding the baby and all that. So those are important information. Yeah, if your baby was born at 30, please don't say your baby is preterm. Your baby is term baby. It's not preterm baby. Your baby is term baby, but your baby is a low birth weight baby because your baby was born 1.9 kilos, even though it was born at 38 weeks. Your baby is term but low birth weight baby. So which is why you are saying your baby is IUGR. For those who don't know what IUGR means, baby has intrauterine growth restriction, which is fine. So your baby is not term baby. Your baby is not preterm. Your baby is a term baby. So, but a low birth weight term baby. So what you need to do, for term babies, we don't correct age. So your baby's weighing 5.5 at 6 kilos. I am very worried about it because it means the baby is still not growing. And the question is why? Why is baby not growing? Is baby eating? Have you started complementary feeds? You breastfeeding? Have you started complementary feeds? Is there any other health issues with the baby? Those are the kind of questions I'm going to be asking you. I just want you to see a pediatrician if you're not seeing one, because this is not something we can solve online right now, but your baby definitely need to be seeing a pediatrician. If you are seeing one already, that's lovely. Okay, but she definitely needs to see one. I'm definitely worried about your baby because most low birth weight babies, once they are born and we start to feed them, they actually, catch up quickly, and so their weight goes back to what should be normal for their own age category. So usually an average 6 months old baby should be weighing like 7.5 kilos. So if your baby is weighing 5.5, I'm worried about that. So I want to be sure there's nothing else going on with the baby, because there may be a reason why your baby stopped growing, and that may also be the reason why the baby is still not growing. So we need to know that. All right. Okay, I think I will just quickly go to the rest of the question on Facebook. My time is up, but let me just finish answer the question because that was one that lost my connection. Apologies for that. So Biamaka said they did a blood test on my baby, but they didn't tell me anything about jaundice, and I later noticed her eyes and skin became yellow after 3 days. Okay. They only told me she has malaria and utero. Is it that they didn't detect the jaundice? Okay, anyway, so when you discover your baby has a jaundice after 3 days, did you go back for a blood test? Did they test the baby again? That's the most important information that I need now, because jaundice is not caused by malaria. For those who think jaundice in babies is malaria, is not one of the causes at all. So it's not malaria. Your baby can have malaria, what we call congenital malaria, which is what they are trying to tell you, that your baby was born and maybe when you were pregnant, you also have malaria yourself, and your baby also have what we call congenital malaria, but it's not due to jaundice and it does not cause jaundice. So if your baby is not having jaundice 3 days after, they need to test the baby for jaundice to tell you how high the jaundice is. And there are two different conditions which can happen at the same time in the same baby. So I hope that's helpful. Olayinka, my daughter of 32 months has noisy breathing at night. We need to know why the baby has noisy breathing at first. That's the most important thing. So it's not steaming. I don't recommend steaming for babies like that. I don't want people to go get hot water burns, at night. You're sleeping, everybody is tired. I'm not going to blame you. Please don't steam babies at night before we go and we now start dealing with burns instead of respiratory issues. So please, see us first. Let's know why the child is having noisy breathing. There are many reasons why people could have noisy breathing. Is there like enlarged adenoids, enlarged tonsils? Is there something in the house? I hope you are not using all these things, what's it called, mosquito coils, and all those generator fumes, things that can really irritate the airway. So we need to have all those information. So that's what I need. So, but it's definitely not just for us to start steaming the baby. We need to know what is wrong first before we now take it up further. All right. All right. Thank you so much. Thank you so much for those who confirmed that you can hear me when I was kind of lost and I'm finding my way back. All right, Felicia Agbo, you didn't tell us. I don't know what your question is, because it's kind of cut off. But if you are still with me, you can say ask and I will answer you. And Toby as well. I hope you got my answer. You definitely need to see a pediatrician. All right. Okay, I think I've answered all the questions that has come in. I hope I didn't miss anybody's question. If your question was lost during the loss in transmission, feel free to quickly repost it and I will answer it before I go away. But also just to remind you that if you still have questions or you are just joining the live session, not to worry. Even when you are watching the recorded episode, you can always go to Ask the Pediatricians, Mondays to Saturdays, 24 hours daily. You can ask your questions on our group and we'll try and answer your question for you as well. So feel free to post your question on our Facebook group. You can be sure that whatever you get from our group is going to be from a pediatrician perspective. So, and if you want to learn more, and I think we've talked a lot about jaundice today, and I can see a lot of people are so worried about jaundice. Actually, you don't need to be worried. So, but if you have if you want to learn more about jaundice, go to our website www.askthepediatricians.com and you can read about jaundice. Just put jaundice in our search box. So there's jaundice in the newborn part 1, part 2. Very lovely. And if you're the type that you don't like to read but you like to listen, just go on my website. My podcast, Ask Dr. Gbemisola ATP podcast, and you can also listen to jaundice as well. And if you're the type that love to watch, actually we've done like ATP hour, like a whole teaching of 1 hour teaching on jaundice. You can go listen to that, watch that also on our YouTube channel. So there are lots of resources that we have for you and just for you to know. And so no need to panic. Don't be scared. Most babies have jaundice and they are fine and nothing will happen to them. Unfortunately, that is a problem because many people that give advice on jaundice, nothing will happen to the baby because the babies have physiological jaundice, even though they've done nothing, even though they've done the wrong thing. They've given papa water, they've put baby in the light, they've put whatever ampiclos. It's because the baby have physiological jaundice. So in other words, whether they do anything or they didn't do anything, the baby will be fine anyway. So because of that, unfortunately, some of the people that they are giving advice to, their own babies are not going to be fine because their own babies have pathological jaundice. So they will not like, oh, but that is what I did for my baby and it works. That's what I did for my baby and it works. Every baby is not the same. And some babies will actually have the severe kind of jaundice. I'm saying that because that is my field. I'm the one, unfortunately, that tends to see people who have problems afterwards. In other words, if we don't do the right things and then your baby develop complications in future, cerebral palsy, developmental delay, you are going to end up with somebody like me, a developmental pediatricians, where the one that will now manage the baby for the rest of their lives. So I'm very passionate about you not hanging up with me because of the of severe jaundice, and because that is the information people always tell me. Oh, why didn't you take your baby to the hospital? Why was this baby not? Well, da, 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 da. And that is always the answer. Oh, we went to the hospital. They told us to come back for the results, and we forgot. Oh, we are planning for the naming ceremony. We forgot, and and people forget. And after the naming, then baby stops talking. The baby end up with us in the hospital, and then we are doing the SB. SB is 40. And I'm not making up what I'm telling you right now. I'm actually remembering a woman in my clinic room telling me this exact story. I'm just telling you what's a scenario that really happened live, and of course, even though we do EBT at that point, we already know that we are too late. And we already know that this baby is going to end up in pediatric neurology or developmental clinic with cerebral palsy. We already know that. But yeah, some people will tell you, some may not tell you. They'll like, just come back for follow-up. So we don't want that to happen. We don't want any baby's brain to be injured or damaged by jaundice. So please, final take-home point for you, for all our mothers, and please pass the message. Be my evangelist. Tell every mother, if your baby has jaundice, it must be tested. They must know the level. There's nothing like papa water, ample gloves, put in the morning sun. No. We need to know the level of the jaundice first. Most jaundice don't need you to do anything. They are going to go away by themselves without you doing anything. But those cases that will not go away, those ones that will be very high, that need to be in the hospital for phototherapy, those are the ones I'm worried about. And those are the ones that may cause brain damage. So we need to pick them up. And we won't pick them up by just looking. We will only know by doing the blood test. So that's why it's so important. So that's my take-home message, because seems today everybody have asked me a lot of questions about jaundice. So I'm going to make it my take-home message. Please encourage, when mothers have babies have jaundice, don't tell them all those things people have been telling you. Please tell them to see a pediatrician. Jaundice is always an emergency. Anything that has to do with the brain is an emergency, because the brain is one organ that is so funny. The brain, we can't repair the brain. Once it's gone, it's gone. That is it. So we don't joke around the brain unlike other parts of the body. So that's why it's so important for us to do the right things. And prevention is always better, cheaper than cure. All right. Thank you so much for joining me today. Apologies for that break with my laptop shutting down. But if you still have any questions, please feel free to go to Ask the Pediatrician's Facebook group. Post your questions there, and we'll be able to answer them. So I come your way again next week, Monday, by God's grace. Have a wonderful, wonderful evening. Just bye. Bye-bye from me.